Hey, I'm Rivera. The endocrine disorder I will be presenting today is menopause. So during menopause, a couple of glands really take center stage, mainly the ovaries and the pituitary gland. The ovaries are the big ones here. They eventually stop releasing eggs and their hormone production, especially estrogen and progesterone, drops a lot. That decrease is what causes most of the classic menopause symptoms, like hot flashes and mood changes. Now, the pituitary gland, which is up in the brain, tries to jump in and help. It starts making more FSH and LH to try to get more the ovaries working again. But since the ovaries don't really respond the same way anymore, those hormone levels just stay high while estrogen and progesterone stay low. So basically, it's the body's way of adjusting to this new phase. One gland slowing down another, trying to pick up the slack. Progesterone's kind of the calming hormone. It helps prepare the body for pregnancy and keeps us feeling more balanced and relaxed. When levels drop, sleep and mood can take a hit. So if you're feeling extra anxious or irritable, low progesterone could be part of the reason. Yes, women have testosterone too. It supports libido, muscle tone, and overall energy. It naturally starts to decline in our 30s, and that can make some menopause symptoms like low energy or reduced sex drive a bit worse. So it's definitely one to keep in mind. Menopause is a completely natural part of getting older. It happens when our ovaries stop releasing eggs and our hormone levels, mainly estrogen and progesterone, start to drop. It's really just our body slowing down their hormone production over time, which is why most women experience it later in life. And sometimes, though, menopause can happen earlier for other reasons. For example, if someone has surgery to remove their ovaries, hormone production stops right away. Treatments like chemotherapy or radiation can also affect the ovaries and trigger early menopause. And for some women, it just runs in the family. Genetics can play a big role when it starts. As you can see in this slide, there is not one set menopause age, but statistics show the average in the US is 51. Many people experience tiredness, weight changes, and hot flashes as their hormones shift. These early symptoms signal the body's adjusting to new hormone levels. These symptoms are most common. Menopause can cause physical changes that can affect daily life. Things like headaches, sleep problems, or digestive issues often appear during this transition. Some cognitive and emotional symptoms would be mood swings, anxiety, and forgetfulness. These are also common. These changes can affect focus and emotional balance, but are a normal part of the process. Hormone shifts can show on the outside too, with thinner hair, brittle nails, or more sensitive skin. Over time, some may notice joint pain, changes in taste, or increased risk of bone loss. Recognizing these patterns helps in managing long-term health. Everyone's experience is a little different, but understanding what's going on can make it a lot easier to handle. When it comes to diagnosis, doctors usually start by reviewing your symptoms and medical history to get a full picture of what's going on. They may also order hormone level tests to confirm any hormonal changes. In some cases, the absence of menstrual periods for an extended time can help with self-recognition of what's happening, but medical confirmation is always recommended. Menopause itself doesn't really need treatment. It's a natural part of aging. But for some women who do have symptoms, treatments can help make things more comfortable. Options include hormone therapy and vaginal estrogen for hot flashes and dryness. There are also newer medicines like fezolinetin and progesterone for specific symptoms. Some low-dose antidepressants or medicines like gabapentin can help with hot flashes too. And of course, there are treatments to protect bone health and manage osteoporosis. Overall, the goal is just to ease symptoms and keep women feeling their best during this stage of their life. Menopause causes a big shift in hormones, mainly a drop in estrogen and progesterone, which affects the body's balance in several ways. For example, women often get hot flashes and night sweats because their body's temperature control changes. Bones can get weaker, increasing the risk of osteoporosis, and the heart and metabolism can be affected too. Mood, sleep, and stress responses may also change. All these changes can impact daily life, causing tiredness, sleep problems, mood swings, and sometimes discomfort during intimacy. The good news is that with the right lifestyle choices and treatments, most of these symptoms can be managed, helping women feel more comfortable and maintain a good quality of life.